you had made at another community meeting around the role of mental health and social workers when it comes to crisis response. Because I believe very much that there should be a much stronger role for social workers to play. Social workers who are well trained, because we want to make sure the equity piece is happening. And I know the comments you made were around social workers not wanting to do that kind of work, not being able to find social workers to do that. And I wanted to first challenge that because I have done that kind of work. I've worked on mobile crisis teams. And I also know that all this summer long, other school social workers worked at the curfew centers till 3 o'clock in the morning. And I believe that when you train people well, when you pay people well, we'll do the work. And so I wanted to hear your commitment, what you think about strengthening that role of social workers to respond to mental health so that police can step back and respond to other things.
Well, Gretchen, that's really a question for me and not for the commission. So we have one of the largest 911 diversion things running in the country, and we're going to be looking to expand that. We're working with our federal partners to expand that. Actually, Allie, raise your hand. If you see this young lady over here, she leads that work. Gretchen, you guys might know each other from previous work, and I think about that. But we're looking to continue to expand that, and I'll just say this and say it quite bluntly. For far too long, we put too much on BPD. It's not their responsibility, and as I said last week, earlier this week and last week, in the city that has the mental health and health systems that we have, if any city can do it, we can do it. And we're going to continue to grow that. We're happy to be a national leader, but we know in the way that our country responds to these things, that doesn't mean that we're perfect by any stance. And thank you and thank everyone else who helped out this summer at the curfew centers, because that was a way for us to, again, show that we want to remove BPD from things that, quite frankly, they shouldn't be doing anyway, and have folks who are highly trained. And we look forward to working with you and anybody else to expand that work, because we want to take more calls to service and have them diverted immediately away to other folks. And we've been working very diligently on that. And I would love to have you connect with Allie to see if you can to help us with that.